Hello everyone, if you're watching. My name is Abby Howes. I'm the Health Information Manager at Blood Cancer UK, and I'm joined today by Claire Harrison, who's going to talk to me and answer a few questions about access to new COVID treatments for people with blood cancer who test positive for COVID. So Claire, would you mind just introducing yourself and your role in the COVID medicines work?
Hi, I'm Claire Harrison. I'm a haematologist based at Guy's and St Thomas's. And over the Christmas period in my other hospital role, which is as clinical director, I was involved in delivering some of the care for patients through our COVID medicines delivery unit, or CMDU.
Lovely, thank you, Claire. So we've got a few questions for you today, if that's all right. So the first one is, what new treatments are there for people with blood cancer who are testing positive for COVID at home? How many new treatments are there? What different types are they? And how are they taken?
Well, it's so exciting, isn't it? And this is one of the reasons I was really happy to be involved with working on our unit, that we now have these medicines that are actually very effective in reducing the risk of patients developing severe COVID, requiring hospitalisation or having a bad outcome from infection. And these medicines are available for patients deemed at higher risk of getting severe COVID. And that could be because of their condition, or it could be, for example, because they might have had a treatment that might stop them responding as well to vaccination. And blood cancer patients would obviously fall into sort of both of those categories. And the new treatments range, and there are several of them currently and more coming, no doubt, as we learn more. So they range from tablets that are antiviral tablets, so they reduce the replication or multiplication of the COVID virus in the patient's body. So that's a little bit like acyclovir, which is sometimes taken by haematology patients to treat a virus infection. So that would be usually sent out to the patient at home. And there's currently one of those called molnupiravir, and shortly there will be another one called Paxlovid. So these are usually sent to patients at home to take over the course of a few days. Or the alternative is for patients to come into hospital, and you can either come on your own steam or you'll come by ambulance, which will be arranged by the CMDU, and have a drip which will contain purified, manufactured antibodies specifically targeting the COVID virus.
Okay, great, thank you. So there's a few different options, from hospital intravenous treatments to tablets to take at home. Mm-hmm. What do people with blood cancer do then if they're at home and they do test positive for COVID, in terms of accessing the treatments? And obviously I'll just say it's the 1st of February 2022 today, and lots of things have been changing, as we all know, through the pandemic, in terms of how to access certain medicines and who can access them. So just to say, we can talk about what people need to do today, but the Blood Cancer UK website obviously will be up to date with the latest information if any of that should change.
So I would definitely say, the situation is changing, and it's changing in a good way because there are different treatments being available, and this is a completely new option. But that can obviously be a bit stressful. So definitely the Blood Cancer UK website is a really good source of information, and also your healthcare team may also be a good source of information as well. So the first thing I would say is, as a blood cancer patient, you should be doing a regular lateral flow test, probably twice a week, and ideally reporting that centrally on the government website. So don't wait until you think you've got typical symptoms of COVID, because certainly more recently, and the patients I was phoning over Christmas might have had symptoms a little bit more similar to a cold, sore throat, stuffy nose, more tired than usual, bit more sneezy, for example. So I would, have a low threshold for doing a lateral flow test. Some of our blood cancer patients have received a letter with a special PCR test and a code, which can be used, but don't worry if you don't have one of those. So do your lateral flow test. If it's positive, then my advice would be to get, at the present time, and it might change, get a PCR test done locally, but also speak to your healthcare team.
Yeah.
And don't wait to get the PCR test done, get it done as soon as possible for reasons that we'll come on to, because these treatments, the sooner they're given, the better they work. And then if you have a positive test or you're worried, there are several sources of information. One is your healthcare team through your local acute advice, through your CNS, your doctor, your GP, or the other possibility, if you've got a positive PCR and you've got symptoms, is to call 111. So all of those individuals are able to refer you into a CMDU, and the CMDU that you get referred into that will offer you treatment is your one that is local to where you live. So if you, for example, normally travelling into, for example, Guy's Hospital, but you live in Colchester, the Colchester related medicines delivery unit will be the one that you would be called by, which is good, because if you have to go there by ambulance, it's better to make the shortest delivery. Not all hospitals have them. There are something between 50 and 70 CMDUs at the present time in the UK. So 111 is a good source of referral, as are your local healthcare team. And, you know, do make the call. Even if you've got a positive lateral flow and you're worried and you're very symptomatic, I would still say call 111, because as someone, again, who's been on the CMDU, if we get a very sick patient with a positive lateral flow, we can sometimes facilitate a quick PCR test for the patient.
Okay, thank you, Claire. So I think the CMDUs, COVID medicine delivery units, are the name for them in England, but there are similar services in Scotland, Wales and Northern Ireland about having a telephone assessment. So I think the crucial thing is that if you have COVID symptoms and you get a positive COVID test and you have blood cancer, you should be able to speak to someone through your healthcare team, be referred for a telephone assessment, and on that telephone assessment you'll discuss with a healthcare professional whether you should try one, whether you could try one of the new COVID treatments that you've outlined. So it's all about getting through to that telephone assessment initially, because not everyone will need the new treatments, will they? But if you have blood cancer, you can have that telephone assessment. That's right. And I think we would always rather speak to a patient and the situation changes a little bit about what type of patients and what types of treatments make people eligible. So it's always good to have the conversation, and I think it's probably reassuring for you as a patient and your family in that circumstance. Yeah. So positive COVID test, you must let your doctor know, your haematology team or your GP, or call 111. Lots of routes in to alert healthcare professionals and to have that telephone assessment. So if someone does have that telephone assessment, Claire, what might they be asked? So they've got through with a positive COVID test and they've got symptoms. I think it's probably handy. I mean, it's good practice anyway, isn't it, to have your medical information to hand. So keep a recent clinic letter and a list of your medications. So there are a few things that, as some, when you're calling, you're going to be wanting to know. First of all, do you have a positive test? When was it positive? And do you have symptoms? And remembering that we spoke about the more subtle symptoms that patients can have now, and particularly thinking about fatigue and increasing fatigue as well. So you'll be asked about the date of onset of those things, because in general, the sooner we treat, the better. And ideally, we should be treating within 5 days. And if you're really outside the 5-day window, then there's no evidence that these treatments will benefit you. So you'll be asked about that. You'll be asked about vaccination status, although at the moment that doesn't alter whether we give a treatment or what type of treatment we give. You'll also be asked about your diagnosis and your previous treatments, because some eligibility is based on diagnosis and some is based on treatment. And also about allergies and your current medication, because there are sometimes some interactions or some allergies that might overlap. Bear in mind that you might not speak to somebody who's a haematologist
and you might be speaking to somebody who doesn't always have access to your records. So it's useful to have that information to hand with you. Other important information will be if you decide to go and you'll be talking to the clinician and they might offer you time to think about it and then phone you back, whether you want to have the tablet treatment or whether you want to have the drip treatment. If, for example, you've got a PICC line or a portacath or a Hickman line or difficult veins, it's useful to tell them that because then they might need to get somebody who can specifically, for example, access the Hickman line and use it. So those are the things that I think are useful to bear in mind.
Great, thank you. That's really helpful tips there. So what reasons might someone be told after that assessment and answering all those questions? Why might someone be told that they probably do need one of the new treatments?
So the clinician that calls will have all the latest guidance in front of them, which includes reference to blood cancers, different types, and different treatments. And they'll be looking for that information from you as a patient. And if you meet those criteria and you've got symptoms and a positive PCR and your symptoms are not largely getting better, then generally the doctor or the nurse will move on and have a conversation with you about, well, we can offer you a treatment and these are the different treatment types. Mm-hmm. And they will go through with the patient regarding pros and cons of different treatments.
Yeah.
Some they have different side effects. Some people may choose that they don't want to come to hospital, for example, and the doctor or the nurse will talk to you, a patient, about how effective different treatments are. Also, if you happen to be pregnant, there are some treatments that we can't give, and if you're breastfeeding, for example, there are some treatments that we can't give. And there are some treatments also that would be specifically for patients under the age of 18, for example. So it's quite complicated, but there is an algorithm that is being followed.
Yeah, and you'll be speaking to a qualified healthcare professional who's qualified to prescribe medicine and who knows the people who, if there are certain things that you can't mix with certain medicines and things. So you'll be having a personalised assessment, won't you?
Yes, absolutely. And it's usually doctors that are making these calls at the moment, but it may not be a haematologist. Mm-hmm. So, it was quite over Christmas, so I could do lots of telephone calls, but right now my day job's quite busy, so I haven't been doing so many. Yeah. But of course, if you have the contact details of your haematology team and you want the COVID medicines delivery unit person to give them a call, then maybe they will, for example, but they will be specifically trained, but they may not be a haematology expert.
Okay, thanks. And you mentioned about if someone's symptoms aren't getting better, is there an element of how well you feel or how mild your symptoms are as to whether you would choose to have one of the treatments? Or what reason might someone have a telephone assessment and then be told you probably don't need one of these new treatments at the moment? Is that happening as well?
Well, there are a few potential outcomes to a telephone call from a COVID medicines unit. One might be, yes, you've got a blood cancer that meets eligibility criteria. You've got a positive PCR, but you've got absolutely no symptoms, and your PCR test was done yesterday. But if you develop symptoms in the next 2, 3, or 4 days, please come back to us, and the unit might give you a number, or they might tell you to come back through 111, for example. They might say your symptoms are largely better now. On balance, maybe we wouldn't offer you a treatment, but there would probably be some discussion about that. Mm. Or they might say, yes, you've got symptoms, now let's discuss which treatment might be better for you. And for under 18s and pregnant patients, an infusion is the only possibility, but otherwise there is the option of an infusion or an antiviral. And the problem is although these are agents with a lot of data behind them, they won't have specific data in, specific blood cancers, for example, and much of the data, it doesn't come from the vaccinated population. But the doctor that's on the phone will have the data and will be able to tell you what the benefits and what the side effects of the treatment are.
Yeah, absolutely. I guess the same as all medicines, it's always a way up, isn't it, of the disadvantages of having it, like side effects, and the benefits of having it. And if the benefits are going to outweigh anything else for you because you're very vulnerable, then you would probably choose to go ahead and have it. But that's, yeah.
Yeah, I think so. And I think the other thing is, it's also, you can say, I'm not sure at the moment. Can I speak to a friend? Can I speak to my partner, my family member? And can I call you back, or can you call me back? And that, that's perfectly reasonable as well, I think.
Yeah. We have been hearing from people on our support line, Claire, at Blood Cancer UK, who've had a positive test but had very mild symptoms, and they've had a telephone assessment, but they've been told that they don't need the new treatments at this moment. As you say, being told if things get worse, then to contact back, but that people are okay to just monitor themselves at home. So what would you say to people in that situation?
I think that's a potential option, isn't it? And it's difficult, but it will depend on a judgment of how vulnerable you are as a patient. If you're a patient with myeloma that's had a stem cell transplant and that's relapsed and is currently having treatment, that might be completely different from someone that's got very early stage blood cancer. Who I treat a lot of patients with MPN, so who might just be on aspirin, for example, and who are otherwise fit and well. So it's going to be down to individual judgment. The national guidance is a little bit unclear. So if the symptoms have completely resolved, then clearly it doesn't seem a good idea to be maybe having extra risk and having a treatment. But if they haven't resolved, or if you're not clear, then I think you really need to weigh that up with the person on the phone, or take the option of maybe having a call the next day if you're not clear, not sure. And we've certainly offered that to some patients.
Yeah, great. Thank you, Claire. I guess one of the final questions, if people don't have the new treatments, what happens next? Are they just told how they can monitor themselves at home, or?
Well, there are a number of potential outcomes, so I can just speak from my experience. So we would usually, if we didn't think a patient was eligible, but they had symptoms, we would offer a service called COVID calling, which we do from the hospital, where we touch base with the patient, or sometimes I would email, for example, the clinical nurse specialist and say, can you give this patient a call? If you really want a treatment, but you're not being offered one on grounds of eligibility, there is a large national study called the Panoramic study, like panorama, like one of those long photos, which you can actually enroll yourself in. If you're either over 50 or you have a condition that makes you vulnerable, and the eligibility for that is slightly different. So if you're really keen, or if you've got a family member who's also got COVID but doesn't have blood cancer and is interested, then they can self-enroll on that study. Of course, the other thing is, it's important to also remember that if you are unlucky enough to have COVID, not get one of these treatments, or decide not to have one, if you get worse and you end up coming into hospital, then you will be offered some of these treatments anyway. These are available for patients in hospital with COVID too. So it's not just a one-off option. And there are plenty of other ways of getting access to treatments.
Yeah, that's really important to know, isn't it? If you do come into hospital with COVID, there are obviously, we've had treatments throughout the pandemic that we've been using in hospital, and we're adding to those all the time as well. And some of these are the same ones. And
some of them are really highly effective. I mean, we haven't spoken about specific treatments, but a lot of these treatments have 80 to 90% effectiveness at reducing the risk of hospitalisation with COVID. And then if a patient's in hospital, again, they give added benefits. So, I mean, it's so exciting. We know so much more about treating COVID and monitoring COVID than we did do at the beginning of the pandemic. So I think, you know, it's still stressful and it's still worrying, but it's also reason to be very hopeful.
Yeah, exactly. And as you say, we've now, a lot of people with blood cancer have had 3 vaccine doses or 4, so they've already potentially got more immunity than what they had when the trials on these drugs were being done. So there's that level of extra protection as well. And, you know, some of the new drugs that we do have, sotrovimab, molnupiravir, Ronapreve, we explain all of those on the Blood Cancer UK website, and we'll continue to add new ones as new ones come into hospital, which we're sure that they will. Thank you very much for talking to me today, Claire. It's been really helpful, and I know that there's been so many questions for the blood cancer community, and it has been lots of information to take in and confusing drug names and, you know, eligibility and things, but I would just like to leave people with the message that we keep the Blood Cancer UK website up to date. We're updating it every day at the moment with how to access these new treatments. As you say, keep doing your lateral flow tests, keep an eye on your symptoms, always tell your doctor if you notice anything different, or if you've got COVID, obviously. And yeah, do use the Blood Cancer UK website and our support line for information and advice. And yeah, just remembering that there's lots of effective treatments out there for people with blood cancer, with COVID, and lots of fantastic healthcare teams to support them as well. Thank you so much for the work you're doing, Claire, as well on the CMDU, because, you know, providing access to people who are at home to these new treatments is obviously life-saving. So we just want to thank you as well from Blood Cancer UK, and thank you for your time today as well.
No problem. I think it would be really important to thank all of the health service and all of the you know, patient advocacy. It's been really, really important, and a great partnership working across all of the teams in all of the hospitals and all of the healthcare settings, right out to 111 and others, for setting up these new treatments, but also for making information available. It's just a fantastic work.
Claire, hi again. It's Abby. We're just doing a quick update to this video that we've recorded. So from Thursday, the 10th of February 2022, a few changes have come into play to allow for some more COVID treatments for people with blood cancer, and hopefully quicker access to them as well. Could you just run us through what's changed after everything we've just talked about? What's changing on the 10th of February for people with blood cancer?
Absolutely. Thanks, Abby. Hi, everyone. Nice to see you again. And really important update for you. So first of all, you don't just have to have a positive PCR. You can be referred to a COVID medicines delivery unit with a positive lateral flow. So important to do the lateral flow. You can log it online and then follow the same routes for referral that we've already been talking about. This is really important because it means that you can get faster access to treatment, and also it doesn't mean you have to hold on to your PCR and worry about the best time to use it. You can order more lateral flow kits. There doesn't seem to be a problem with availability of those, and then test. And important to test even if you only have mild symptoms, so sore throat, stuffy nose, because you can always test again. And the other really exciting thing is now, when we first spoke, Abby, there were only 2 treatments, and now there are actually 4 different treatments that will be on offer, and one of those treatments has been shown to be effective for up to 7 days after the onset of symptoms. So usually our target is treat within 5, and ideally treat as soon as possible, because the sooner we treat, the better the outcome for patient. So that's the lateral flow helps with that, and then we've got lots more treatment options. So there's a new pill which is called Paxlovid, which is made up of 2 other pills, but complicated names, ritonavir and rinatrelvir or something like that. That drug is a tablet, more effective than one of the current tablets that we have, but it has got a lot of complicated drug-drug interactions and have to be very cautious in patients who've got impaired kidney or liver function. So just to reiterate again, really important to have your clinical details, all of the drugs that you're on, and if you've got any recent blood tests, that will be really helpful for the team when they do call you. And there's also access to using remdesivir, which is the agent that is effective up to 7 days, which we haven't had in the COVID medicines units, but we've been using in hospitals. So 4 different treatments, and being able to get referred early is really important. But it's important to know to test and to communicate with your team.
Thank you so much, Claire. And you mentioned there COVID medicines delivery units. I know that you're working in one of them in England. In Scotland, Wales and Northern Ireland, they're not necessarily called CMDUs, but they've got similar services. And it's the same route of access to these new COVID treatments. If you have a lateral flow, positive lateral flow test, you can straight away be referred for a telephone assessment to have a discussion about the new treatments. And you can do that by calling 111 or going through your doctor or your clinical team. But as you say, it's great that people can now get that referral off the back of a lateral flow test that takes half an hour rather than having to wait for a PCR. And when you do get the telephone assessment, we've got the extra treatments there as well. So thank you for helping me do that update for our community, Claire. I know the blood cancer community, there's a lot of information for people to absorb, but this information obviously is really important for people to get those new medicines if they test positive. So thank you for all you're doing, and thank you for helping us clarify that information for our community.
No problem. I just thought it might be useful just to say to people, if they're unlucky and they call up and they're not eligible, one thing to do might be to check that with your clinical team, because blood cancer can be really complicated. And occasionally there are some patients with blood cancers who might not be eligible because maybe they haven't had active treatment recently. And there is just a quick advert for a running study called the Panoramic trial, which you can Google and enter if you, for example, had treatment a long time ago for your blood cancer. Sorry, Abby, to just put that in at the end. I forgot that extra new thing. Yes.
No, that's really important, Claire. And I think it's worth saying as well to our community, isn't it, that if you do have that telephone assessment, you are having a personalised assessment with a qualified healthcare professional who's qualified to prescribe medicines. And if you are told that you don't need one of the new COVID medicines at that time, that may well happen, and that's okay as well. Just check it with your clinical team, make sure you're monitoring yourself at home, and Panoramic trial is an opportunity to get involved in research and maybe have a new treatment as well, but not to be too anxious if you're told you don't need one of those new treatments, because it will be based on an individual assessment.
Yeah, absolutely. Thanks very much, Abby, for the opportunity to join you today.
Thanks very much, Claire. Thank you. Bye-bye, everyone.